Within the United States, there's over 37 million people diagnosed with diabetes. That's 1 in every 10 person who suffers from diabetes. Asian Americans in particular have the highest prevalence of developing type 2 diabetes. However, when compared to other Asian ethnicities, the Hmong are 3.3 times more likely to develop type 2 diabetes, the most among all Asian American groups. So let's explore why that is and what can we do to curb this ever-rising epidemic within the Hmong community. This is Lou Lau from the University of UC Davis. He conducted a study to understand why the Hmong were so susceptible to developing type 2 diabetes, as well as what could be done to help combat this.
The purpose of the study was to see how common diabetes, was at that time in the Hmong community compared to the other group, right? Because I think a lot of studies have been done on the other groups, immigrant groups, but I think that there are not enough study to look at the Hmong population. When I did the study, I compared the Hmong groups to the other Asian groups, including Laotian, Vietnamese, and Chinese, and I compared to the blacks and whites and Hispanics, and turned out that the Hmong, out of the group, the Hmong patient had the highest, rate of diabetes. So that is something that I think, as you mentioned, that's something that we really need to work with our older folks, or even going forward, right? I think maybe some of those has to do with our genetic, the way that through evolution, our genes were wired to kind of help us survive. And now that we're in a different environment, we may be more prone to develop those metabolic conditions. And the second thing is the lifestyle that we live too, the food that we eat and the food that we eat and the lifestyle that we live right now, not as active as we used to do.
In order for us to understand how deadly diabetes can be, it's important to understand what type 2 diabetes does to our bodies. When food enters our stomach, it's converted into glucose, the body's main source of energy. Our pancreas then produces insulin to help transfer glucose to our cells to be converted into energy. Insulin acts as a key to allow glucose to pass through our cell membranes and be used for energy. However, when you have type 2 diabetes, your insulin receptors no longer work properly. Therefore, glucose cannot pass through your cell membrane. Because glucose can't enter your cell membrane to be used as energy, it builds up in your bloodstream, which can result in other complications within your body, such as stroke, heart attack, cataracts, glaucoma, or many other complications.
When diabetes that never got treated, or just having blood pressure that never got treated because no one ever really had symptoms when it was there, early on in the phase, right? Even though the disease itself has, slowly been doing harms and doing damage to the body until the point where, patient presented, or until the point where they develop heart attack or stroke or something bad happened, and then they're like, hey, yeah, it's because of you have bad diabetes for so many years, or bad diabetes, hypertension for so many years. And so that's what led to me to just, work on these projects.
Through Lou's study, they found that the likelihood of a Hmong individual developing type 2 diabetes was 27%, compared to the national average of 9.8%.
Rice is still the main staple in the home, right? So, maybe eventually as we're moving away from rice and noodles and all those high carbs food, maybe the prevalence of this metabolic disease, including diabetes and hypertension, may change. But I think that just because we consume a lot of rice, at least in my family, rice is consumed almost in every meal, right? Major meals of the day, breakfast, lunch, and dinner. So if you think of that, right, rice, especially white rice, has a lot of sugar or carbs. I think oftentimes we may not think of that unless we are diagnosed with diabetes, or unless someone that we know has diabetes, and then through the awareness that we receive from our provider, that's when that's when we're putting more thought into the food that we eat. But I think that rice is one of the driver behind it.
When compared to other Southeast Asian ethnicities, such as Laotian and Vietnamese, the Hmong community still had a higher chance of developing type 2 diabetes. At 27.23%, they're followed by Laotian at 24% and Vietnamese at 16.57%. What makes the issue even more alarming is that the Hmong also have the lowest rates for diabetes control or treatment. The Hmong came in at 31%, much lower than Laotian, which came in at 51%, and well below the Vietnamese, who came in at 71%.
Not only did the Hmong have the highest rate of diabetes, but they also have the worst control of their diabetes, right? Compared to all the other groups. That says a lot about us as Hmong, as a group, being prone to this disease, and also, not having the adequate medical care, or just having some other factors that make it hard for our diabetes to be controlled as compared to the other groups. It's hard to say, but for lack of a better word, I think that a lot of the terminology that we use in medicine are not, translatable into Hmong. Like it's not like a one-on-one translation, and so a lot of medicines, all medication has side effects, right? So risks and benefits, and so if you tell a elderly Hmong woman or a man about the risks and the benefits and side effects, they're gonna have second thoughts, right? And you tell them that, hey, it can damage your kidneys, or it can do this and that to you, even though it's a side effects. But if you were to translate that to Hmong, I think it's be kind of hard, right, to translate that, hey, we're not saying that this will occur for sure, but these are some of the things that may occur, with this medication. Although the benefits of you taking these medications a lot outweigh the risk a lot more, but it's just hard to really, like separate the two to really make them to fully appreciate the benefits more than the risk.
Although diabetes cannot be cured, Lou does believe that with a combination of diet and lifestyle changes, along with education and alternative exercises, can lead to a reduction of type 2 diabetes within the Hmong community.
We need more people from our community to be in the healthcare, become healthcare providers, so that we can, go back and, kind of help people from our community. Because, unless you understand the struggles, right? Unless you grow up with it, or you have family or friends who went through the struggles, unless you personally experience in one way or another, you won't be able to connect with the patient who's gone through the struggles, right? Because I think that's the only, for at least for me, that's the only one way where you can really see why the really struggles. And even when you understand the struggle, and and see what the issue is, it doesn't mean that you're always going to find a solution, right? Because I don't think that rice is ever going to go away from our staple or our diet. But I think that if you understand that, hey, if they cannot cut out rice completely, maybe you can substitute with like brown rice or something, while they cut down the portions. That's one way to do it. Or you can think of like, hey, maybe Hmong people don't like to go to the gym or exercise, but hey, maybe they can go fish, or go hike, or go hunt. They like to do more outdoor stuff, right? So you kind of have to understand your patients and the thing that they like to do, and kind of work around their preference. I think it'll be hard for us as the younger folks to go to our parents or our grandparents, being like, hey, these are the things that you shouldn't do because they're bad for you, right? I don't think anyone will be more open to the idea, right? Versus you go to them and you be like, hey, these things too much can do bad for you, but a little bit's okay. So why don't we cut back, or why don't we substitute to something else?